So we learned early on in the COVID pandemic that some of the infection was being shed through feces, and that there would be potentially an opportunity to track the level of infection in a community by measuring the virus that's found in the sewage. It's opening a manhole, it's putting in what's called a composite sampler, which is drawing a small amount of wastewater out of the pipe every 15 minutes. And over 24 hours, we have a composite sample of whatever went through that pipe. And so we take that jug and we take a small amount of the sample out of that jug and we send it off to our labs here at U of L, then purify that and then count it up and send it off for sequencing. So when we look over time, the appearance of a new variant, like the Delta variant, which showed up in June here in Jefferson County, what you'll see is it shows up in one place is colored red, and then what you see is the next week, a couple of more places are colored red, and then it sort of bleeds its way across the county. That's what happens, and it's a cycle that we've seen repeat several times now as variants come into the community.
It gives us a good heads up as to what's actually happening on a macro level in the community without having to sample, hundreds and hundreds of individuals. The sequencing studies that are done can tell you if something new is beginning to show up, and I think that's one of the most important elements of it.